Well, welcome to the Financial Armor Show. My name is Brad Cooper, the CEO of Cooper Financial Investments. And as always, I want to welcome my amazing co-host, Tony Shore. How you doing today, Tony?
I'm doing great, Brad. Thanks for asking. And of course, thanks for having me on the show today. I'm
Yes.
really excited because, wow, I mean, we've had some pretty good guests before, but today is really great. I'm excited about this show. It's something that we haven't talked about on the show before. So this is going to be a good one, isn't it?
It is. I am so excited. And seems like week in and week out, we're just so blessed and fortunate to be adding more and more experts and guests on different topics. And I'll be the first to tell you there's not a person, there's not a guest that we have on the show, Tony, that I personally am either a patient, a client, an investor of. And so, what you see, what you hear from our experts is exactly what Brad Cooper and his family is taking on a daily basis.
That's great.
So, well, how's everything up north in Minnesota? Is the snow
Well,
gone?
no, we got another inch of snow last night. It was 74 degrees on Friday and sunny. I mean, shorts weather here. And by last night, it was in the 20s and we had an inch of snow.
That is crazy.
It is
Well,
nuts.
well, I had to shovel a little bit of sunshine
Oh,
yesterday, so I
yeah.
may have hurt my back a little bit, but I survived.
You can
So,
tell that I'm in Minnesota and not Arizona because I'm a whiter shade of pale. There was a song back in the late 60s, early 70s, Whiter Shade of Pale, it was called. And this is the group was Procol Harum. You should give it a listen. But I think they wrote that about me. I was pretty young yet, but yeah, I wish you're rubbing it in about the great weather. You guys are down there in God's country, and I'm
yes.
suffering up here in Minnesota, but I'm envious. I'm envious. But Brad, I know you've been busy. We
Yeah.
don't need to go over that because it's just you're going to wear me out. Your schedule wears me out
Wow.
if I ask you what you've been doing. You keep so busy there. Let's jump right in and introduce our very special guest today. This is
Yes.
awesome. I mean, you have the greatest friends.
I
They're
do.
experts in all these various fields, and so they're not just people who are experts in their fields. They're friends of yours. That's what I love about our guests.
Absolutely, Tony. And if you're having a challenge like I did in the past by finding friends, you can always pay someone to be your friend. Just kidding. But no, I am so excited and so thankful. The guest we have on today, I've known for about 3 years. I became a patient, and we just developed an amazing relationship. And they're clients of ours. But more importantly, what they do, what they have personally done for me, which I'll share here in a little bit, but what they're doing, which they call precision medicine, I call preventive care, being proactive. And what we're going to talk about today is just so good. But I want to welcome my good friend, Dr. Muro. Welcome, Doctor.
Oh my goodness. Thank you guys. You guys are hilarious. I love listening to you guys. So yes, I just thank you guys for allowing me this opportunity to kind of speak and just participate. This is great. Thank you for having me.
Well,
Yeah.
Dr. Murrow, why don't you tell our listeners just over the next few minutes or seconds, because we have so much to go through, a little bit about yourself, your partner, Dr. Neil Morris, as well, and your practice and your background.
Yeah, so thank you. Yeah, that's great. So, I've been working in medicine for about 20 years now, and it really started off with my kiddos. Both my children were born with cleft lip and palate. And so, working in the medical field, you don't realize how lack of control and how overwhelming things can be. And so, really working on the other side, where I was a parent and a father, gave me a better and a different perspective on health and how to really kind of advocate for self. And really, that's what changed the way that I do medicine, and why I really felt urged and called to get into medicine was really being impactful in a positive manner to get best patient outcomes. And so one of the things that we see in normal medicine, in the traditional model inside the hospital setting is everything is perfect for surgical intervention, for taking care of somebody in an emergency. But outside of that, we start to see breakdowns. And that's where I think this kind of medicine, precision or even preventative medicine, makes such a big impact. Getting to somebody's issues, getting to the root cause of those issues, and really addressing them before they become issues. That's really where I and Dr. Morris, my business partner and also friend, we really work towards. And so we've got a clinic out in Arizona. Our goal is to focus on building people up so that they can live their best life, to optimize their current status. So most of the time we're doing a bit of regenerative medicine, things like helping people with chronic pain or with acute pain. But to get their bodies ready for that, we really have to address their whole system. Because when the body is not really set up for success because of deficiencies in minerals or lacking foundations, such as people that have poor quality of diets, they're not sleeping, if they're having difficulties with stress management, we address all of those root causes, but we also have to take care of those things like deficiencies, micronutrients, hormonal imbalancements. And by doing those things, people feel better, they look younger, and they respond better to any therapy, and their quality of life just accelerates. So that's kind of where we focus in.
Yeah, when
Wow.
I first met you, going on 3 years ago now, I'll never forget, my first introduction, you know, I believe there's a questionnaire that I had to complete, which took me a good hour to complete about me. Then when I came in for the first visit, the blood work, I think you checked over 100 different areas, which I've never had done before by a primary care physician or any healthcare. And I'll never forget when I came back, Brad, you're tired in the afternoon, aren't you? You're having trouble losing weight, aren't you? You asked me all these questions, which you already knew the answers to, and here's the reason why. And from that point on, I realized, why have I never received the treatment and care and the education to be proactive in my entire life up until this point? And Dr. Murray, you're a wellness doctor, so I can tell our listeners all day the biggest difference between you and traditional healthcare, which both are very important, but what you do is you're trying to prevent people from going into the hospital from in the future and maintaining their lives. And really a topic that we have talked a lot about in front of groups, seminars, and meetings is health and wealth. If you have all the money in the world and don't have your health, who cares?
Yeah.
Or vice versa.
Yeah, I totally agree. I think that I was reading a really great book, and it was talking about finances, and it said the first thing that you need to do is invest in yourself. And I think that that's one of those things that you're an
Right.
advocate of, is not only how can you invest in yourself financially, but when you look at it from a holistic standpoint, what are we doing on a daily basis to really invest in you, your health, your family, and being intentional about it. And I think that's the biggest change, or the biggest dynamic change that we see inside this realm, is being intentional with health to get best outcomes, and really putting that treasure of time into prevention and quality of life.
And time, you're exactly right. Tony and I have had many, many conversations over the years about parents being in nursing homes. My father passed away a couple years ago, but just a story I just want to quickly share to our listeners, which is really going to tie into the type of preventive care that you and Dr. Morse are going to be rolling out in the weeks to come, which I'm so excited. To use my father-in-law for an example, second father to me for the last 40 years. Basically, he's 80 years old. Up until 2 years ago, he's never been in the hospital in his entire life. And
Wow.
just in the last 2 years, twice, just here recently, they had to put a stent in. Then he went back, had a stroke, and now he's in acute rehab. The reason why I'm sharing that with you is because that ties into the treatment, which I'm excited about, not only cardiovascular, heart disease, but also a big fear that we all have, or at least I do, and I know a lot of my clients do, is maybe early onsets of dementia, Alzheimer's, Parkinson's, and the list goes on. So spend a little bit of time talking about what you and Dr. Morris are going to be rolling out. And I'm going to be the first in line, as far as preventive care, especially if we can be proactive now with what we can do to maybe minimize the chances or maybe avoid the chance of even getting any of those areas just by being proactive and not have to worry about by the time I get to age 70, my life is over because I have dementia.
Yeah. Let me tell you, I'm really excited about this new aspect of our clinic. Many of the things that we find is that there's a barrier sometimes to see concierge medicine or cash-based practices, and that's the risk factor. Is, do I have the treasure to put forth to risk it? Right? Because time and treasure are the two things that most people kind of concerns themselves with the most. And so what's really great is that this is going to be an insurance-based model, part of our practice. But one of the biggest things that we have been finding out, we're part of a great group called A4M, which is an anti-aging group, and they're a collective of doctors from all over the world. And I get to participate and be part of that group. And one of the things that we talk about is inflammation, and that inflammation causing things like oxidation, which is almost like rust in the inside of our body. And then that leading towards worse outcomes, things like, systemic inflammation. And inside the vascular system, it's called endothelial dysfunction. And really what that is that the body just starts to inflame. And it's a positive, a push positive kind of mechanism where little stimuli of inflammation kind of add together and synergistically will continue to add, leading towards things like heart disease, strokes, dementia. In fact, they say dementia is kind of like the diabetes type 3, right? It's
Wow.
inflammation of the vascular system leading to the brain, and the brain's defensive mechanism building those proteins, those the malproteins and the beta amyloids and things like this. But really, the really exciting thing is how can we start affecting this inflammatory process early? So a lot of the research is saying that that this inflammatory process starts at the early ages of like 10 to 20 years old, where it starts to cause problems systemically because of the foods that we eat, because of the lifestyles that we live, because of the exposures to toxins that we have. And so it's been difficult for a lot of doctors to go in there and to affect change. Usually we try to get to where we start stopping the pathway or reducing the pathway. But what's really exciting is that this IV therapy that we're able to implement, we can push inside the body, bypassing all of those other pathways, just directly absorbing into the vascular system major anti-inflammatories that your body naturally produces, but may over time decrease in action. I'll give you an example. Your body produces something called glutathione. Glutathione is the major antioxidant of the body. Well, we can do IV therapy, and part of that IV therapy, we can put glutathione inside of it. And what happens is that it reduces inflammation and it stops that pathway. So you get, not only do you feel better, you have more energy, but that inflammation will stop and start to reduce. And that's really exciting because we can start to play a big role in preventing some of these problems. We look at different markers called high sensitivity C-reactive protein or homocysteine levels. And these tell us like how risky it is for cardiovascular disease. But we can then use and leverage your insurance to push these pathways instead of taking loads and loads of supplements. And so that's pretty exciting for me. We always work on the foundations of health, which is eating cleaner, getting better rest, stress management. And we kind of talk to everybody about those things. And what's really great is that I usually spend about an hour with everybody. But when we talk about doing this kind of
Right.
level of intense treatment, IV therapy, we can be very precise by doing things like the magnesium and glutathione and different vitamins to make a big impact. And so it's really exciting for me as far as that. But what's really cool, if I hate to rant on, but what's really good is that in a couple months, which is exactly what you were alluding to,
Right.
we're going to be implementing elite physicals, and elite physicals are really powerful because it's a great way to find things out in the body before they become problematic. Doing things like ultrasounds of your carotids, ultrasounds of your thyroid, looking at your heart like an echocardiogram, looking at your aorta and making sure that there's no plaque buildup, making sure that we're preventing things like ruptures of the vascular system, making sure that the heart is beating strong and healthy, doing testing to make sure that you have no balance problems, so that most people, as they age, their bones become more brittle, and a small fall can lead to a hip fracture, and that can cause not only hospitalization and needing for surgery, but a lot of the times that's the last time that person walks. It could lead to death in many people. The other thing that we could do is it's kind of like a image of the brain to determine early onsets of things like dementia or Alzheimer's. And all of this will be done yearly in the office, covered by insurance in a limited format, in order for us to identify if there's any indicators of issues. And say if we do find something like a mass of the thyroid or plaque in the arteries, now we can offer some some things to kind of intervene, but really it's about getting you right in front of the right people, send you to a specialist so that you can get worked up early before it becomes a problem. One of the really scary statistics talks about the first symptom and sign of heart disease in men is a heart attack. The
Wow.
first symptom and sign. In women, it's a little earlier too. The first symptom is a heart attack. And so that's why so many people we see in their 40s and 50s, if they have a heart attack, it's a one and done. A lot of the time, it becomes a massive problem, and so much so that it can take your life. And this is what the power of doing prevention and early intervention will be. And so it's really exciting for us.
Wow. Very exciting for me as well. We often talk about holistic financial planning, but you truly do holistic healthcare. And my experience, which I've shared with our listeners the last several years with everything we've been through with my wife, and, thank God for great healthcare. But, what is aggravating, they are more reactive, where you're more proactive. And now, from just my experience, I'm sure a lot of listeners can relate to this too. Wow, why didn't the healthcare industry or pharmaceutical industry prepare me and tell me the information I'm learning from you, Dr. Merle, Dr. Morris? Why didn't they teach me that? Why? Because it comes down to money. And one last thing I'll add, of being a patient, you're right. Insurance is covering some services, but what does not make sense to me at all, which I know why, this service that you provide and have been providing me the last 3 years that I've had to pay cash for, and thank God I've had the cash, that's changed my life physically and mentally. Why aren't insurance companies covering that? And I think we all know the answer to that, because there's not enough money. They want to be reactive, and that's what's exciting about that. So, just to let our listeners know, if you have any questions, you can always go to financialarmorshow.com, and ask any questions you want, or you can call our office at 888-390-5277. And just real quick, Dr. Merle, how would someone go about contacting you if they had questions and if they just wanted to come in for a consultation just to see what services that you have to offer?
Yeah, the best way to get a hold of us is contacting us at 1-855-347-3543. That's a phone number that you can text or call. The other one is just to jump online to restorehealthaz.com. And on there, it has some ways to get a hold of us. But those two are probably, of course, phone a friend. Calling you and getting a hold of you, but yeah,
Well,
definitely, those are good ways to get a hold of us.
and too, I want to add here, just a couple weeks ago, Dr. Muro and Dr. Morris were so kind to come into our office, and I interviewed the two of them, which when that is finally released and they edit all the ahs and uhs out of my voice, we will have that posted with a lot of the same information on our website, and we'll be sharing that with them as well. So, but no, this topic of wellness and health, which ties into wealth, is so important. Just yesterday, I was meeting with a client to be, and we met them about a month ago, and he's getting ready to retire, early 60s, young. They've done very well, but then his wife wasn't with him. So I started, asking questions. She's terminally ill.
Oh,
And doesn't know. She may live another year, maybe another 5 years. And it's like, wow. And I know you're not miracle workers, Dr. Murrow, but I do know from experience and from all the conversations we've had that, most people don't know what they don't know. And if I would have met you even 5 years ago, if my wife would have met you 5 years ago, I think the outcome of where she ended up would be completely different. So that's one of the many reasons why I had Dr. Murrow on the show today. And I know, Tony, this is a much different topic, isn't it, from other topics we had?
it is, but it's so important. And Dr. Murrow, I love what you're doing there, and I'm glad you explained it to us in detail because, and it's a perfect name for it, precision medicine and preventative care. I think is so important, and to really, I don't know why this hasn't been done more in the past, but like Brad said, probably money. The healthcare industry has its limitations and issues, but I just think this needs to be done more. And the really in-depth scans and blood analysis and trying to head things off before they get to a certain point, or at least figuring out where you're at. That's so important. I mean, if I was in your area, I'd be in there tomorrow. So that's fantastic.
It is. I'm so excited. We have planned for later this year and in the years to come to do a lot of speaking events together, and
It's great.
and just have that just circle and encompass the topic of health and wealth. And it's something I shared actually this morning with a client. I said, you really don't think about your health as much until you get older. And I have a good friend that in his 70s had a heart attack. And he should be dead, but he survived by the grace of God. He's doing good now. But he said, wow, if I would have known I was going to live this long, I would have taken better care of myself. And I know that's the type of services, Dr. Murrow, you and your team are doing. And it's just the empowering of information, education, and knowledge and wisdom that is not being taught out there.
Right.
And to be able to maintain a good, healthy energy life now while I'm approaching 60 years old here in a couple of years, and for the decades to come, it's exciting. So any last things that you would like to share with our listeners, Dr. Murrow? Because I know that we could, go on for hours and hours on different other services and preventive care you're doing that are so important. But what other comments or advice would you give to our listeners?
Yeah, I think that it's kind of like investing, right? Whenever you start investing, you're putting little tiny incremental jumps into the market in order to do that, like, bottom dollar cost averaging, right? And so we do that as we continue in this life in order to reap a benefit later on in life. But many of your clients probably come to you and say, if only I wished I had invested 20 years ago when I was,
Right.
much younger. Or really what I like to do is we started a 529 for like my son when he was just born and my daughter, in order so that they can leverage that. It's the same thing with health, right? The best time to invest was 20, 30 years ago.
Right.
The next best time is, how about today? Really, when we look at things like prevention, what's really great is that it doesn't matter where we are, because we can meet you where you are. We can identify some concerns and some issues, really get ahead of that, or to really make a big impact in that area. But it's really about what happens 5 years from now, 10 years from now, 20 years from now. A good example is I have a close relative that called me and said, hey, by the way, I just did some blood work and I just did a blood pressure check. My blood pressure is 180 over 90 today. And I said, well, what do you mean it's 180 over 90? That everybody knows that that's too high. And I said, well, do you have any symptoms? He goes, no, I feel great. I go, you don't have any headache? No. You don't feel nauseous? No. I go, why would you check your blood pressure? And he goes, I don't know. It was there. And I just randomly looked. And I said, that's the problem. When you look, you find problems. But I didn't tell him that. I really told him, I go, well, I'm glad that you looked. The problem is that now we probably know that this has been going on for a long time, and that you're walking around with that elevated blood pressure, and that's a time bomb. And I said, listen, what we're going to do is we're going to get you the emergency room today, because it's beyond what we need to do. We have to go make sure that you're not urgently in need, right? So I had to get him out of there. But then I said, but you're going to come back and we're going to work on diet. We're going to work on lifestyle. We're going to work on stress management. We're going to stop drinking Monster energy drinks or any of those energy drinks. Not saying that Monster is bad or good. It's just what is. And usually it's harder on the body than beneficial. But
Sure.
there's a lot of things that you can do every day, the small steps. And so I would just say, don't neglect the small things in life that make the biggest impacts, because those are the pillars of health. And we'd love to play a role in making a big impact for better outcomes, because I want to live another 50 years, but I want to do it with money. So I'm going to hang out with you, Brad.
Yeah, there you go.
And I'm going to hang out with you because I want my health, and I'm a little bit older. So, well, wow, what a quick show this has been. As we close, I just want to encourage all of our listeners to reach out. You don't know what you don't know. And just visit for a consultation, which is minimal cost, if any, with Dr. Muro. You're going to find out, yes, you're on the right path. You're going to live another 50 years. Or, wow, something major popped up. We can treat that now to save your life in the years to come. So again, Dr. Muro, I want you to share your contact information. And again, it's on our website, and you can call our office as well. But go ahead and share your information as we close.
Yeah, check us out on things like Facebook and Instagram, Restore Health AZ. Also online, restorehealthaz.com. And then, of course, you can always call us or text us at 1-855-347-3543.
Great.
All right. Well, great show. Thanks for being on, Dr. Muro. Great guest to bring in, Brad. Keep Dr. Muro. I'm sure we'll be back at some point.
Absolutely.
We'll have to have him back on the show. It's been a good one. And again, if people have questions for Brad or want to set up a consultation with Brad and his team there, they can go to financialarmorshow.com. And that does it for today's episode of the Financial Armor Show with our host, Brad Cooper.
Thank you, Tony.